Thank you.
And take a seat. There's more than one way of running a consultation for patients with back pain. You can use tools such as STarT Back easily within a 10-minute consultation, and that helps you as a clinician to identify those patients who are at higher risk of developing longer-term problems with their back, and also identify groups of patients who are likely to get better without very much input from healthcare professionals. Okay, so I've taken a good look at your back and given me a lot of information about the back pain. What would really be helpful for me is if you're able to fill in this very short questionnaire, which just helps me to understand specifically about how you've been feeling about the back pain over the last 2 weeks.
Yes,
Is that okay?
All right.
And it would just take you a minute or so, and I'll just tap some stuff in your notes whilst you're doing that.
Okay,
That's okay.
thank you.
Thanks. So the STarT Back tool can classify patients into low, medium or high risk groups, and that means low, medium or high risk of developing a long-term problem with their back. Patients who are identified as being at low risk, you can have the confidence to manage those patients in primary care with usual advice around analgesia and activity. Patients who are at medium or high risk of developing a long-term problem should be referred on to physiotherapy, where those barriers to their improvement can be addressed. Sometimes GPs feel that the idea of running another questionnaire within a consultation when you're already under time pressure is problematic, but STarT Back can be deployed really in around about a minute in a consultation, and that time can be used just to catch up on your notes whilst the patient's filling in the questionnaire. Okay, good. So the information from the questionnaire and from taking the history, that we put you in a low risk category for your back pain.
Could you explain that to me?
Yeah, sure. What low risk means is low risk of developing a long-term problem with the back pain. It doesn't mean you're in low levels of pain, because I can obviously see that you are in quite a bit of pain. It means that the outlook for you is really good, and we would expect this back pain to settle down over the next couple of weeks. So for patients identified as low risk from the STarT Back questionnaire, it's important to acknowledge that they may be in quite a lot of pain, but actually the outlook for them is good, and you can be confident to advise analgesia and activity for these patients. Those at medium and high risk need a slightly different approach, and you should start early looking at the barriers that are stopping them improving with their back pain and starting to address those barriers early.
Obviously, that's good to hear, but is there anything I can be doing to help myself?
Yeah, sure. So we'd say to keep moving as much as possible, using painkillers to help get on top of the pain, so you're able to keep moving as normally as possible.
Well, I have been resting in bed. Is that the wrong thing to do?
What we know is if you rest up with the back pain, you end up with stiff muscles and weak muscles in the back, and that can actually end up with the pain lasting a longer period of time.
Okay, what about painkillers?
What have you been using up to now?
Just a couple of paracetamol, but it hasn't been much help really.
Okay, so I think the paracetamol are a good first step with back pain. So we would suggest using 2 paracetamol every 4 to 6 hours and taking them regularly, so you're not waiting for the pain to get a lot worse before you take your next dose. Then there are other options we could use to add in on top of the paracetamol if that's not holding the pain. So the message with back pain is to keep moving as much as possible. That can seem counterintuitive to many patients, because when they start moving, the back can hurt more. But the message I try to give patients is that hurt doesn't mean harm. So the pain that they get when they're moving around doesn't mean that they're doing more damage to the back. Often patients who are at high risk of developing longer term problems with their back are very fearful of movement and the pain that comes with it. And so they need lots of reassurance and advice that the pain they experience is normal, and it won't cause them more problems with the back, and that movement is good for our backs. Similarly, with analgesia, many patients feel that taking painkillers may mask something more serious going on in the back. And again, the message that needs to come across is that taking painkillers actually manages the pain better, and so that people are able to return to normal activities more quickly.
What about work?
Can you just remind me what line of work you're in?
Yes, I'm a classroom assistant.
And what sort of things does that involve doing?
Oh, varied things, from running after the children to just doing paperwork.
Okay. And so if we were able to get the pain a bit better controlled, what kind of activities would you be able to do, do you think, at
Well, I
work?
could certainly do the paperwork.
Okay. What I'd suggest is we do something called a fit note, and that's a way for me to communicate with your employer. And what I would put on there is that for the next 2 weeks, you could possibly do light duties or admin work, and then return to your normal activities as the pain improves. Would that be okay? It's important to start conversations around work early on when you're consulting with patients with back pain. We know that there's a window of opportunity where you can help people get back to the workplace, and that the longer people are off work, the less likely they are to return to work. So I try to focus on the things that people are able to do at work rather than the things that they're not able to do. And for that, you really need to get an understanding about the kind of activities people do in their workplace. Managing return to work is challenging for employers as well as employees, and some employers are reluctant to take people back who are not fully fit or fully recovered from their episode of back pain. But we know that really you don't have to be 100% pain-free to safely return to the workplace. So using tools like fit notes can be really helpful to open those channels of communication between you as the healthcare professional, the employee and the employer, and facilitate that person's safe return to work early on.
I had been thinking about an X-ray.
Yeah, that's a really good question. And X-rays and scans won't tell us a great deal more about the cause of your pain. They can be very helpful if in back pain if the nerves in the back are affected. But we know with the kind of back pain that you've got, which is basically around the lower back, that the X-rays and scans won't give us a great deal more information as to the cause of your pain. Many patients with back pain will come to their consultation thinking that they need an X-ray or a scan, and it's important to have those conversations, otherwise patients will leave the consultation with some questions unanswered. Unless there's suspicion of red flag pathology, X-rays and MRIs aren't indicated for back pain, and patients can be reassured that X-rays and MRIs won't add anything extra to the clinical picture or affect their management plan.
Yeah, that's been really helpful. I just wanted to say, if things don't settle down, what shall I do then?
If over the next 2 weeks you find your pain is getting worse, and it's even with the painkillers that you're using, or if the pain is going on for longer than the next two weeks and it doesn't feel like it's getting better, then come back and see me. And what we would do is make another assessment of your back and then decide the best course of action from there.
Okay, well, thanks very much.
No problem. In the meantime, what I'd suggest is take some information away with you. This has got some information about the back pain, but also some simple exercises that you can be doing almost as first aid for your back over the next couple of weeks.
I see.
Is that all right?
Yes, thank you.
There you go.
Thank you very much. Okay, thanks a lot.
Bye now.
Thank you.
Patients should leave a consultation with a clear plan that should include management of their pain, physical activity, what to do if things get worse or don't get better, and for patients at medium or high risk, information about their onward referral to physiotherapy. All patients should receive information either printed or with signposted to information on the internet about back pain and what they can do to help themselves.